Hi, everyone. So, this is everything you need to know about the hepatitis B vaccine. What is hepatitis B? Hepatitis B is a liver infection from the hepatitis B virus, also known as HBV, that causes mild illness for a few weeks, or it can cause serious lifelong illness. It is vaccine preventable. Most people who get vaccinated with the hepatitis B vaccine are immune for life. What are the types of infection? There are two types of hepatitis B infections. First one is acute and second one is chronic. Acute hepatitis B infection is short-term, while chronic hepatitis B infection is long-term. Acute hepatitis B infection has symptoms such as causing a fever, fatigue, nausea, lack of appetite, vomiting, pain in muscles, joints, and stomach, and jaundice, which is yellow skin or eyes, dark urine, and clay-colored bowel movement. Chronic hepatitis B infection occurs when the virus has been remaining in the person's body for a while. This is because most people do not even have any symptoms, which can lead to liver damage, liver cancer, or death. How is hepatitis B spread? It is spread through blood, semen, or body fluid. A person can be infected through birth. So if the mother has hepatitis B, it can spread to the baby. Sharing items like razors or toothbrushes with an infected person, contact with blood or sores of an infected person, sexual intercourse with an infected person, needles, syringes, or other drug injection equipment, exposure to blood from needle sticks or other sharps. When is the hepatitis B vaccine usually given? So if you know it or not, most people are given the first dose at birth, and the series completes at 6 to 18 months. Birth dose is extremely important to prevent long-term illness for infants and spread in the United States. After giving the first dose, whether at birth or after birth, the second and third dose is administered at 1 and 6 months. The vaccine is given as 2, 3, or 4 shots and can be just one shot or as part of a combination, depending on the provider and the rules. Who else should get the vaccine? Children and adolescents younger than 19 years old who haven't gotten the vaccine yet, adults who have not been vaccinated but want to be protected, people who are involved in sexual activity, people who live with someone infected, healthcare and public safety workers who are at risk of exposure, people living in jail or prison, and people with chronic liver disease, kidney disease, HIV infection, hepatitis C infection, or diabetes. Can you get the hepatitis B vaccine at the same time as other vaccines? Yes, you can, and this is because there is no risk to getting the hepatitis B vaccine the same time as other vaccines. Why is getting the hepatitis B vaccine important to the public? This is because in the past, for example, in 2018, there was about 21,600 acute hepatitis B cases reported in the United States. That is crazy. Between 880,000 to 1.89 million people are living with HBV in the United States. In 2018, about 1,649 deaths in the United States were recorded from HBV. Chronic hepatitis B accounts for 14% of U.S. general population and 69% of non-U.S. born people. Getting the vaccine will help the spread of HBV, prevent illness or death from HBV, and maintain the safety of the world's population. So let's keep it clean and get vaccinated because getting vaccinated shouldn't ruffle your feathers. The vaccine itself cannot cause hepatitis B disease. So if you or someone you know is hesitant of getting the hepatitis B vaccine because they are nervous that they may be at a risk of contracting the disease, you can let them know that no, the vaccine itself cannot cause hepatitis B disease. What is the vaccine made out of? I know that maybe you or someone you know may be hesitant of getting the vaccine because they do not know what is inside the vaccine or what it is made out of. Because why would you want to put something in your body if you do not know what it contains? But let me tell you, it contains aluminum to strengthen and lengthen your immune response to the vaccine, yeast proteins to grow hepatitis B proteins, formaldehyde to kill the viruses in the vaccine, sodium chloride, salts, or sodium borate to act as an acidity regulator. There are no live viruses in the vaccine. How great! The side effects of the vaccine contain headache, pain, redness, swelling at the injection site, feeling tired, loss of appetite, fever, stomach pain, dizziness, flu-like symptoms, muscle aches, low blood pressure, rashes, swollen glands in neck, armpit, or groin, and rarely it could cause an allergic reaction, or also known as anaphylaxis. And side effects last up to 1 to 2 days. Overall, is the vaccine safe? Actually, the hepatitis B vaccine is considered to be one of the most safe and effective vaccines ever made. All vaccines can have side effects. So that's completely normal if you or you know someone who has had side effects from a vaccine. There is no evidence of the hepatitis B vaccine causing autism, autoimmune disorders, chronic fatigue syndrome, chronic illness, multiple sclerosis, optic neuritis, rheumatoid arthritis, seizures, sudden infant death syndrome, or transverse myelitis. Overall, yes, the vaccine is safe. So let's all get vaccinated and keep the world safe.